I'm very lucky that cannabis exists, because if it didn't, I'd be in a very bad position.
Medicinal marijuana should be legal in the UK.
Duty for cannabis possession has been dropping like a stone in the past few years.
There is sort of de facto decriminalisation going on. But it's
The UK is currently at grips with the debate surrounding medical cannabis. Those in favour are exploring how best to persuade the government of the medical properties of the drug. Meanwhile, those against are voicing their concerns about the harmful aspects the drug can have on health and society at large. But with 80% of the public and 68% of MPs surveyed being in favour of medicinal cannabis, it may only be a matter of time before the UK government acts in favour of its legalisation. Cannabis was made illegal for recreational use in 1928. However, prior to the 1971 Misuse of Drugs Act that prohibited cannabis use across the board, it was a legitimate medicine for treatment of pain, famously used by Queen Victoria, who used it to soothe menstrual cramps. Despite blanket illegality of the drug, there are numerous people throughout the UK who use it to treat illness and pain. Jacob Barrows, 29, and has been self-medicating with cannabis since 2008, following an experimental operation that attempted to rectify problems he had with his internal organs at birth.
So they cut 11 inches downwards and then around my belly button, and then pulled my lower intestines and that out. I was diagnosed with chronic neuropathic pain, it'd be like 2-3 years ago.
Over the years, he has been prescribed numerous government-approved medicines to remedy his pain, but for Jacob, cannabis works best.
I can get out of bed with confidence knowing that if I'm uncomfortable, I can have a quick suck on my vaporiser and I'll be fine within literally 30-40 seconds.
By using cannabis under the current laws, Jacob could face up to 5 years in prison.
The last specialist I had seen over me promised me that he'd protect me in court if I ever got into trouble.
Baroness Molly Meacher, chair of the All-Party Parliamentary Group for Drug Reform, is leading the charge for legalising and regulating cannabis for medical use.
I suppose I come at it from the mental health perspective. People with serious psychiatric disorders would always take cannabis, and I would ask them, why are you taking cannabis? You know, is that not a good idea? And they would say, it may make my voices worse, but it helps me feel human.
With the help of Professor Mike Barnes, an expert in neurological rehabilitation, the APPG for Drug Reform issued a report documenting their findings after 7 months of research into the medicinal properties of cannabis.
We found some very good evidence for the use of cannabis medically for 4 key conditions. Chronic pain, that's all sorts of pain, including nerve pain, so-called neuropathic pain, anxiety, nausea and vomiting, mainly after chemotherapy, which is a big problem, and the other thing is muscle spasticity or muscle spasm. And about 10% of people have some troublesome short-term effects, that means 90% don't. Those 10% have problems like dizziness and drowsiness and dry mouth.
I consume a lot of it, and so I do feel the anxiety part of it, and that can sometimes stop me from getting out of the house.
And we found that yes, cannabis can cause a psychotic episode, but generally it's only in heavy recreational users, young people, males more than females, and those who are prone to schizophrenia or have a family history of schizophrenia.
Renowned journalist Peter Hitchens, an opposer of cannabis law reform, had this to say. The answer is very simple. Cannabis is illegal because it's a dangerous drug, increasingly associated with irreversible, severe mental illness, often used by perpetrators of violent crime and terror attacks, and dangerous drugs obviously aren't suitable for use as medicines, even if they have some good effects. A negative stigma may stand in the way of legitimate medical urgency.
We want to stay right away from the arguments about social use of cannabis. British people are not ready for that.
I'm talking about marijuana. You may have heard of it. You may have seen someone smoking it, like those burnout bohemians.
In the UK, a cannabis culture has been allowed to develop through decriminalisation of those who use it for personal, recreational reasons, despite illegality, raising suspicions of a grey area surrounding cannabis law.
You're going to be people that enjoy having a smoke, and there's nothing wrong in that.
There's no realistic aim of eradicating drug use in the country, yet still these very popular substances are technically illegal. So we see the situation as inadequate and that there needs to be some change in policy, but we welcome all different approaches on how we could get there, and we're just trying to start a debate about how better to deal with drugs in this country.
If you want to regulate it properly, which ultimately we want to see done, then you've got to have a bill, an Act of Parliament. They will have their licensed growers and producers, they will have their licensed outlets, you know, regulated, properly done, and then cannabis medicines would be prescribable by GPs, presumably on the NHS.
This year I applied for a private member's bill. I'll do the same again next year. What's lacking at the moment is the government. They're significantly behind not only where members of parliament are, but where the public are as well.
Colorado, Washington, through state referendum, they're experimenting with legal marijuana.
Thousands of people have marched through Berlin to call for the legalization of marijuana.
The marijuana thing is such a big thing. I think medical should happen, right? Don't we agree?
As it stands, the government are yet to react to the debate, leaving many patients like Jacob with no choice but to indulge in what the UK regards as a criminal act.
Really depressing having this situation throughout your entire life. So to have a medication that doesn't make you feel worse once you've taken it, it can sometimes give you a couple of giggles. I feel much better for having the cannabis than having anything else. I do.